Mrs. Maggie Jones was a nurse who worked in a prison setting. She was reported to the Board of Nursing through a complaint received as a follow-up to findings of a peer review committee. The committee determined that Nurse Jones exposed an inmate to risk of harm because of failure to adequately care for him.
The inmate, Mr. Jimmy X, who had a history of attempted suicide through hanging, had succeeded in hanging himself from the ceiling on the night of the reported incident, but was quickly taken down and transported by gurney to the prison emergency room. Nurse Jones had been assigned as charge nurse for the prison ER during the night shift. She was also responsible for orienting the new hire, Nurse Phillips. Mrs. Paulina Phillips was a newly hired registered nurse who had only had her license for about 3 months, as she was in her second month of practice at the facility and was on orientation with Nurse Jones. The following is a reenactment of what happened that night. Once in the emergency room, Mr. X began to struggle. The staff decided to restrain him and place him prone with his legs brought up and secured close to his buttocks. Mr. X continued to struggle and started moaning, after which he quickly became unresponsive to staff. Security staff became concerned about Mr. X's lack of movement and summoned medical assistance.
Mr. Jimmy? Mr. Jimmy? There's some bruising. Okay, we need to untie him.
Is he breathing?
Jimmy. Okay, I'm gonna go make the necessary phone calls.
Okay. Code, I need help.
A code was initiated, but Mr. X did not respond and died from positional asphyxia.
An autopsy of the inmate showed mild hemorrhage in the soft tissue and anterior to the larynx, severe congestion of the conjunctival and scleral vessels, severe congestion of the lungs, and petechiae on the epicardial surface of the heart. The pathologist determined that this inmate's death was caused by positional asphyxia. These conclusions were based on the autopsy findings and the events that were just shown to you in the video. This death could have been prevented.
The following interviews were conducted as part of this investigation.
Well, this incident was my first code, and I never done CPR, and no one was helping him, so I had to do it. Nurse Jones, she's supposed to preceptor me, but she just left the room.
I've oriented new staff a number of times, and I'm a great nurse. I've gotten good feedback. Throughout my career, I've gotten good feedback from my supervisors. I was following standard protocol. That's the security measures that we are supposed to use. Patients are routinely put in that position and with those restraints for security reasons, and we need to do that in order to keep both the patients and ourselves safe. No, I don't have advanced cardiac life support certification, and no, I don't have CPR either. In my opinion, I really don't think that a reasonable correctional nurse would have foreseen that Mr. Jimmy would suffer from positional asphyxia.
Jones's actions demonstrated that she had no awareness of the possibility of post-trauma swelling and edema that could compromise breathing, and that this possibility would not be immediately observable without appropriate assessment. This lack of awareness constituted a major knowledge deficit. In this instance, the post-hanging injury and the hogtie restraint placed the patient at risk for asphyxiation. The cause of death, according to the autopsy, was positional asphyxia, not injury from the attempted hanging. It is important to note that Nurse Jones did not take a leadership role in the code and attributed this to her lack of experience. But during the investigation, it was found that Nurse Jones had been a licensed practical nurse for many years. But once in that emergency situation, Nurse Jones did not take the lead during the resuscitation attempt and left new hire Nurse Phillips by herself to perform CPR and find people to help her. In summary, the specific allegations indicated that Nurse Jones failed to conduct a thorough assessment of the inmate and continually evaluate and initiate life-saving measures. The committee concluded that Nurse Jones exhibited an inability to supervise and lead subordinates in cardiopulmonary resuscitation, which resulted in the inmate's death.